Welcome back to our live show. When taking any medications, it's important to realize that there are potential harmful side effects that can occur when taking multiple prescription medications, over-the-counter medications, even vitamins and herbal supplements. So today we want to talk about the dangers of possible drug interactions. We're joined by internal medicine specialist, Dr. Christopher Dietz. Good morning to you.
Good morning.
A lot of us don't think about it. When we take medications, what can potentially happen? What are some of the possible side effects we can get if we take two things that don't go together?
The interactions between many prescription medications are real. So many times you'll see patients you're going to prescribe a particular antibiotic for them. If they're on certain medications like blood thinners, the antibiotic can potentiate that blood thinner and cause a bleeding disorder. Sometimes some antiarrhythmic medications for their heart, it can make them go into a dangerous heart rhythm. And certain medications combined, they potentiate one another and can cause more serious side effects than what we would expect.
So that's why it's so important when we go to the doctor and we fill out that form that asks us what we're taking, that we put everything on the list, not only prescription medications, but maybe if we're taking certain vitamins or supplements or even herbal supplements.
Absolutely. It's very important not to be embarrassed by any supplements that you might be taking. Have an open and frank discussion with your healthcare provider so they can prescribe medication safely for you.
And that's also a good conversation to have with our pharmacists, because a lot of times we have prescription medications in particular coming from different doctors, and maybe we don't pass along all that information, and that's something that perhaps the pharmacist can catch for us.
Absolutely true. I've had multiple occasions where I've written a medicine for a patient and I didn't know that they were taking a particular medicine because they were seeing another provider. The pharmacist called me and said, "Hey, did you know that this patient's taking this medicine?" And I didn't know. So the pharmacist is another safety net to make sure that the patient's going to be safe with what they're taking.
Let's talk about things that we might think are benign, that might have some interactions, like if you have a soda or several cups of coffee a day, that caffeine can be a potential problem.
Absolutely. We don't think of as supplements or herbal supplements as being drugs, but they truly are. They're just naturally occurring. So caffeine is a drug. And so it can interact with other medications, definitely. Medications for attention deficit disorder, it can interact with those medications. Caffeine can interact with other medications where it actually potentiates that medication to a higher degree than we would anticipate if they weren't drinking a lot of caffeine, and can inhibit the breakdown of that medication. So it's important to know how much coffee or tea you're drinking and realize that caffeine is a drug, even though it's occurring naturally.
And what about something like smoking? Is the nicotine a potential problem? So if it's nicotine, then if you're taking a nicotine patch or something like that, that's also a potential problem.
There are lots of substances in cigarette smoke. And some of those substances can actually cause your liver to make an enzyme in a greater degree called cytochrome P450. And this enzyme is designed to break down medications. So in a heavy smoker, they may have a very high level of this enzyme, and so they can degrade their medications much more quickly. So if you're smoking and you suddenly change the amount that you're smoking, or you suddenly stop, and you're taking medications for antidepressants, are very common, that this P450 enzyme will break them down more quickly. So we might be giving you higher doses of medicine because you're a smoker, and then you suddenly stop, and now you've got too much medicine. So even smoking, we need to know how much you're smoking. That's why we ask every time you come in, how much are you smoking? And then if you're going to make a change to that, you should make your healthcare provider aware, because they may have to alter the dose of some of your prescription medications.
And also on some prescription medications, we see on the label, do not drink alcohol when you're taking this medication. So obviously alcohol is an interaction.
Alcohol is a big one that can cause interactions. Alcohol taken with certain pain medications and certain other medications can really cause you some problems, especially with respiratory depression. So alcohol mixed with a benzodiazepine like Ativan or Xanax can be devastating. You should never combine those. So that's why it's important too that we always ask you, well, if you drink alcohol, how much a day do you drink? These are all things, again, alcohol is a drug, and we need to know how much you're taking so we can prescribe safely.
And foods can sometimes be interactions too. I know a lot of medications you can't drink or eat. Grapefruit, that's one of the main things, but I'm sure there are other things that interact as well.
There are. When you're on particular blood thinners, eating a certain amount of green leafy vegetables can potentiate the effect of the blood thinner. So certain foods we need to kind of keep in a steady state so that we can keep your blood thinned appropriately. When you alter your diet quickly, it can either potentiate or even negate the effect of the medication that we're trying to use to keep you safe.
I know it's kind of a broad thing, but are there any potential side effects we should be looking for in case something wasn't caught and we are taking something that interacts with something else?
Certain things you can watch out for. If you're taking blood thinners and suddenly you notice bruising that's all over, that's a warning sign. Someone needs to be made aware of that. Heart palpitations, heart irregularities, your heart's really racing really fast. Any sort of nausea, vomiting, or sedation with the new medication, those are things that should be evaluated sooner rather than later.
And we go all the way back to the beginning. Make sure we talk to our doctor.
Absolutely. It is crucial that you just be open and honest, tell us what you're taking. All the electronic medical record that we use at MedExpress has an interaction checker built in, so if you tell me what you're taking and I can have a list, what I'm prescribing will be cross-checked through those to make sure that it's completely safe when you walk out our center.
Dr. Christies, thanks so much for joining us today.
Thank you for having me.
Lots of great information. And to get more information on this topic, we'll post a link on our show website by early this afternoon. Just go to WTVR.com/VTM.